The World Health Organization is an extraordinary institution. You know, it was founded back in 1948 in association with the United Nations, and it is now 77 years of age. What it does is bring the world's countries together. There are now 197 countries that are members of the World Health Organization in order to improve the health of the people of the world. Certainly with infectious diseases, this is very evident. The World Health Organization works to prepare people, the peoples of the world, the ministries of health around the world, to deal with ongoing infections and also to prepare for pandemics. It has been so very important in eliminating smallpox from the world. We're on the verge of eliminating polio. We've profoundly reduced the occurrence of polio. We've helped the countries of the world deal with HIV, Ebola, Zika, most recently, of course, COVID, Mpox since COVID, and now the threat of bird flu. Go on. But people work together, share information about what's happening regarding infectious diseases around the world, share specimens, share training, share expertise. This is a way our global village, and we are a global village, works together. The viruses out there don't need a passport. They travel readily. And I can assure you, the world has become smaller from the point of view of ease of transport and the numbers of people who are traveling among the countries of the world over those 77 years of the World Health Organization's working. The U.S. plays a very prominent role. It accounts for almost a fifth of the funding of the World Health Organization. It has had an influence on how the World Health Organization works. It has people from the U.S. working with the World Health Organization, not only in Geneva, but in places around the world. And to go back just a moment to the eradication of smallpox, the two leaders of that effort, Dr. D.A. Henderson and Dr. William Fege, came from our CDC and took their lessons from infection and communicable disease control here in the U.S. to the world so successfully. And from a completely selfish point of view, that is, someone here in the U.S., we will be less tuned in to what is happening around the world. We won't be able to participate as effectively in guiding responses to, for example, bird flu, which is on the agenda of all of us in public health at the present time. So we won't be able to be as engaged. It's so much better to be internal, working with everyone, rather than outside. In terms of global health, we are in a more isolated position, being not part of the World Health Organization. You know, you can put up walls, but the viruses don't care. The Americans participate in the World Health Organization for two reasons. One is our humanitarian instincts. We wish to reach out and help the less served. But the other is in our own self-interest, because what's over there can quickly be over here. And the more we are engaged with the world's community, we have a better and earlier sense of what's over there, and we can prepare ourselves. By not being associated with the World Health Organization, we'll get the word last rather than first. We will continue to engage with the world's health community. All of us have colleagues abroad. We will be using our informal networks, our organizations, our professional and public health organizations will be working with public health organizations nonetheless, but it won't be within that formal structure of the World Health Organizations. And there's something very important out there that's called white coat diplomacy. The way to make friends with people around the world, and we have the need for friends, is to be interested in and help other countries enhance the health of their own populations. That goes to their hearts as well as their minds. That is the way the US has always helped other countries and made friends. Reach out with a helping hand rather than with a fist, and you'll make friends and you'll have allies that are clearly aligned with you. So that's in our self-interest. I'll go back to emphasizing the humanitarian interest, those interests that the US population has always extended formally and informally through their religious organizations and others to help the developing world improve. There's certainly a great sense of disappointment already, and a puzzlement of why we would wish to do this because of all the benefits that accrue from working with the World Health Organization. We are responsible for, roughly speaking, about a fifth of the funding of the World Health Organization. And unless the WHO can now make that up by contributions from other organizations, their activities will have to diminish. They will have to reduce programs, let people go, because that would be a large diminution in their budget. And so I would anticipate that the world's health circumstances will not be bettered by our leaving the WHO. We would all agree that there are many countries in the world, our own at the fore, that did not have an ideal response to COVID. And I think the World Health Organization can share some of that. In other words, there are many lessons to be learned from COVID so that we're in a better position to respond to the next pandemic, because there will be one. I don't know when, I don't know which bug will cause it, which virus. I don't know exactly what form it will take, but there will be other pandemics. And I hope we will have all learned many lessons, the World Health Organization and our own country, so that we respond in a more expedient fashion. And of course, we all know that the threat of a pending pandemic that's looming at the present time has to do with bird flu. Should the bird flu virus acquire the genetic capacity to spread readily from person to person, then we would see essentially the entire world's population newly susceptible to this new version of influenza. And that would be a pandemic. A pandemic is an epidemic that involves the entire world's population, and it would take a couple of years easily for this virus to circulate around the world, and it would cause an enormous amount of illness, hospitalizations, and deaths, I'm afraid. So that would provide the next challenge. I think the world's countries are better prepared. Efficient, probably never, but certainly better prepared. And we would be very better prepared if we took to heart the lessons that we should have learned from our response to COVID. But just speaking for those of us in the US, there are many people who have a very short attention span, and sometimes those lessons don't remain with us. So
that's right.
I'm halfway there. Yes, we're better prepared, but I wonder whether we've learned all the lessons we should have. I'm still optimistic. I think the world's medical and public health communities continue to be devoted to bettering the health of the peoples of the world, and I think we ought to continue to join in that effort. We have a history of triumph and advances that extend back over the 77 years of the World Health Organization's existence, and we can carry that tradition on into the future to make sure that our children and grandchildren and their children have a healthier and, as a consequence, happier and more productive life.